uncontrolled diabetes and resistant hypertension, chronic inactivity, crippling anxiety, weight-related disability, side effects from medication, drug interactions, multiple worsening long-term conditions, and long waits for specialist support. And that's just your first patient of the day, and you've not even had your Monday morning coffee. We know the challenges you face. Diabetes has doubled in the last 15 years. 2/3 of UK adults are now obese or overweight. There's a rising tide of mental health problems and reduced access to services that people need. Patients are dissatisfied and primary care can't meet the demand. Everyone knows that prevention is better than cure, but we end up treating symptoms instead of addressing root causes. You find yourself prescribing pills when what's really needed is lifestyle change. You want to do the right thing, but you just don't have the time. What we're doing isn't working for patients or health professionals, and we all know that something needs to change, but how can you do it?
We created the Living Well course to help people reduce the risk of developing long-term conditions such as diabetes, heart disease, depression, and dementia. We drew on the principles of evidence-based lifestyle medicine, and both from our own experience as GPs and from the best of those health professionals around us.
The results were even better than we'd imagined, with patients improving their physical health and mental health, and even reversing conditions like prediabetes and hypertension. And everyone who joined on the course said that it gave them a greater sense of well-being and more control over their health.
As word spread, we started to get a lot of requests from other healthcare professionals wanting to run their own Living Well course. And we soon realised that the wider members of the workforce team, such as health coaches, social prescribers, pharmacists, and personal trainers, could run the Living Well course just as well as doctors, and actually, if not better. This led us to develop the Living Well course training programme. We've since created this in multiple locations and run it with excellent feedback.
Our course empowers you with the evidence-based principles of lifestyle medicine: sleep, eat, move, relax, connect, purpose and meaning in life. And we also look at principles of behaviour change, helping people to come up with their own wellbeing plans. And in addition, we provide the course materials, practical tips on presentation skills and group dynamics, and offer ongoing mentoring and support.
As a team, we have several decades of medical experience. We've lived through countless health secretaries, numerous reformations of the NHS, and lived with the frustration of the disease-based and reactive approach to disease that so often is the part of primary care. We have discovered in the last few years that lifestyle medicine is so often the answer to the problems of the patients with long-term conditions who sit before us, and that delivering lifestyle medicine through groups can be transformational. One guy I had attending a lifestyle medicine course was a chap called David. He started with type 2 diabetes, rheumatoid arthritis and metabolic liver. By the end of the course, all his diseases were improving. His metabolic liver had gone, and within 18 months he'd lost 7 inches off his waist. We know that it's a challenge to learn to work in a new way. And that is why we've created the 4-week Living Well course, together with a training program for the people who are going to be running this course. So if you, your practice, your PCN or other organisation are interested in this very affordable course, please get in touch.